Hello, welcome to Autism Start Here, What Families Need to Know. Part 2 of this short webinar series is designed to impart information about autism, its treatments, and the services available in New Jersey. This webinar is made possible by the New Jersey Department of Human Services Office on Autism and Autism New Jersey. Part 2 is an introduction to state and local resources. My name is Amy Smith, and I am the Information Director for Autism New Jersey. I've been a part of many of the resources we will discuss today for more than 25 years. When parents first receive a diagnosis of autism, or sometimes before an official diagnosis is confirmed, and they suspect that their child may have special needs, they may feel a wide variety of emotions. Fear, anger, and even relief are all common. Parents may not know where to turn for assistance and be unaware of services offered. Hopefully today, we can get you started on the right path. Let's review some of the most important service systems available in New Jersey. Early intervention services work with children and families from birth to age 3. School-age services address the needs of individuals aged 3 to 21. Adult services address the needs of individuals aged 21 and above. Early intervention is a system of services that helps babies and toddlers with developmental delays or disabilities. Early intervention focuses on helping eligible babies and toddlers learn the basic and brand new skills that typically develop during the first 3 years of life, such as reaching, rolling, crawling, and walking, thinking, learning, solving problems, talking, listening, understanding, playing, feeling secure and happy, and eating and dressing. Sometimes it is known from the moment a child is born that early intervention services will be essential in helping the child grow and develop. Often this is so for children who are diagnosed at birth with a specific condition or who experience significant prematurity, very low birth weight, illness, or surgery soon after being born. Even before heading home from the hospital, this child's parents may be given a referral to their local early intervention office. Some children have a relatively routine entry into the world, but may develop more slowly than others, experience setbacks, or develop in ways that seem very different from other children. For these children, a visit with a developmental pediatrician and a thorough evaluation may lead to an early intervention referral. In order to access early intervention services in New Jersey, parents need to contact the toll-free number for the system point of entry at 888-653-4463. During that call, a service coordinator will discuss parental concerns with the family. As a result of the conversation, an evaluation may be scheduled. In order for a child to be evaluated by the New Jersey Early Intervention System, families must give their consent. Children with a documented diagnosis of autism spectrum disorder are eligible for services. Prior to an official diagnosis, children may be eligible if demonstrating delays in 2 or more areas of development or when one area of development shows significant delay. Certain developmental areas are evaluated to assess skills. These might include physical development, cognitive development, communication development, social and emotional development, and adaptive functioning. Following the evaluation process, an Individualized Family Service Plan, IFSP, is written at a meeting with the family, the service coordinator, and at least one member of the evaluation team, and anyone else the family wishes to include. The IFSP is a written document that identifies services and supports needed for the child and family. It is based on information collected from the family, as well as the evaluation and assessment. In order for a child to receive services, the parent must consent to the plan. Parents have a right to withdraw consent at any time. Out of the services offered, parents can reject some services and accept others. The plan is reviewed every 6 months or more frequently as appropriate to make sure it continues to meet the needs of the child and family. At least once a year, parents participate in a meeting to review the child's outcomes and the IFSP services for any changes needed. If an infant or toddler has a disability or a developmental delay in one or more of the previous developmental areas, that child will likely be eligible for early intervention services. Those services will be tailored to meet the child's individual needs and may include those services listed here. Services may also be provided to address the needs and priorities of the child's family. Family-directed services are meant to help family members understand the special needs of their child and how to enhance his or her development. One service offered through early intervention is called developmental intervention. This service can take many forms based on the child's needs. Methods based on the principles of and practices of applied behavior analysis, ABA, fall under the category of developmental intervention. Thus, if a parent would like to request ABA services, they can do so within the discussion of what type of developmental intervention they see as the best fit for their child and family. Parents may have to contribute to the cost of early intervention services depending on family size and income levels. School-age services include special education, private health insurance, and services administered through the Department of Children and Families. Accessing special education follows a similar path to early intervention. However, parents should contact their local school district and identify their child as potentially needing special education services. After evaluations are either accepted from early intervention or conducted by the school district child study team, an individualized educational program, an IEP, is developed. Eligibility occurs when it is determined that the student has a defined disability that affects his or her educational performance. A student deemed eligible for special education services has a right to a free appropriate public education, also known as FAPE. Appropriate is defined differently for each child. And again, a plan called an Individualized Educational Program, or plan, is developed in order for services to be implemented. The IEP is an important document which drives all services that a student receives through the school system. Special education may also include related services which support students in achieving goals and objectives stated in the IEP. These related services may include counseling, medical services, occupational therapy, physical therapy, social work services, and speech and language services. In addition to school services, students may also access services through their parents' private health insurance to supplement what schools may be providing. There are also services available through the Department of Children and Families, also known as DCF. Eligibility must be established in order to access DCF services, and the way to do that would be by calling Perform Care, who is the system administrator of services for the Children's System of Care under the Department of Children and Families. Perform Care can be reached at 877-652-7624. Services for those over the age of 21 are also called adult services. They may include both vocational and residential services, and individuals must be deemed eligible for Medicaid and eligible for DDD services in order to access those services. For more information about adult services, feel free to contact DDD at 800-832-9173 or visit their website listed here. To get more information about New Jersey state systems that provide programs and services for people with autism and other developmental disabilities, please visit the New Jersey Office on Autism at the website listed here, and download Autism: Navigating Through the Maze, a family guide to navigating the New Jersey service system for individuals with autism spectrum disorder and other developmental disabilities. For more information about autism, you can also reach out to Autism New Jersey at our toll-free line 800-4-AUTISM, email us at information@autismnj, or visit our website at www.autismnj.org, where you can find valuable information and resources about autism, its treatments, and advice on navigating service systems. Thanks for listening.